Okay, good morning, good afternoon, good evening, all of you joining us today for a virtual dialogue on the UICC strategy review. Welcome to everybody, welcome friends, welcome members, welcome partners of UICC. Is a great opportunity to exchange our results on where we are in the strategy review process. So thank you so much for joining us. I understand also some board members also joining us, so welcome everyone. So if I could ask you to put your name and your organization on the chat box, that would be good. My name is Maria Barbara Leon. I'm Chief Operating Officer of UICC, and I'm delighted to be here. You might recall that this is the second virtual dialogue that we hold on the strategy review process, and we have some information to share with you. We last met in March and before the data gathering phase, and now we are happy to share some results with you. So before we start, we go through some ground rules. So unmute yourself only if you're gonna talk. If your connection allows it, please put your camera on and open the chat box and feel free to put your comments on. We have a whole team behind us dealing and managing the whole virtual dialogue. So contact them if you have any technical issues on membership at uicc.org. And last but not least, if you have a phone, have it by hand, because we'll have some Menti for some to make the meeting more interactive. So let's go to the content of this virtual dialogue. So what we'll do is that we will present some highlights on the membership survey. You might recall that the strategy review had some membership survey questions also. And then we have some great news to share with you. And then we go through the preliminary results of that strategic review questionnaire that we send around to members, to partners, and to key stakeholders. Then we also talk through about the timeline of what members and partners could expect next. And then we have some closing remarks. In between those points, we would have some discussion and then we hope that you could contribute to the discussion all throughout. So today we have our CEO, Cary Adams, joining us, and he'll go through the preliminary results. That's me in the middle, so I'm Maria Barbara, as I mentioned, and then we also have our president Anil D'Cruz that will remind us about the importance of the process of this process that UICC is undertaking. So Anil, without any further delay, the floor is yours.
Thanks, Maria. Am I heard, seen?
You've heard and seen.
Lovely. So thank you for the brief introduction. And it's really my privilege as UICC president, along with the board of directors and the staff at Geneva, to welcome you all to this strategic review and share the progress that we've made since last March. It's very encouraging to see a diverse group of engaged members of the community participating again in this second virtual dialogue. We've had about over 100 registrations from our members, and a couple of board members have also registered for this progress. So it's really heartening to see such a warm and large engagement in the second virtual dialogue of the strategic review. As Maria said in our introductory comments, we last convened in March, where we presented the progress and impact of the UICC since 2010, as well as the last strategic review outcomes from 2018. we had some interesting discussions, the first discussions on the challenges and opportunities for the cancer community that we face. There were some very, very heartwarming comments that we received. And could I have my first slide up, please? So we posed 2 questions to our members and asked for their feedback on these 2 questions that you can see on the screen now. If UICC didn't exist, what would be missing the most? And you can see from the comments that we got, they were very heartwarming. And exactly the second for the second question, if UICC was a person, how would you describe it the most? And there were words like watchdog, convener, change maker, passionate, key player, champion, global advocate. And to the first question, what would be we missing the most? Knowledge sharing, knowledge, networking, connections, and it just really puts the role of UICC in its proper perspective. Very heartwarming for all of us who have been part of UICC and championing the cause of cancer control. Can I have my second slide? I'll just quickly recap the strategic review process for you all and then hand over to Cary, who will take us through the member survey and the feedback that we got on that. So basically the strategic review process comes once every 4 years. The UICC is charged with reviewing its strategic ambition, reassessing the long-term ambitions based on the changing landscape of cancer control globally. Well, this process involves reaching out to the UICC members, our partners, other global health leaders who can help us understand the challenges and opportunities that we have in the next 10 to 15 years. The strategic plan will set out our views about the future of cancer control, the mega trends affecting society, and how UICC and its members would adapt to those anticipated changes in the coming years. It's very important that we have participation from our UICC members. It's critical in the process that we deliver a good strategic review. Well, once again, it's a pleasure to welcome all of you all, and I thank all of you all for participating in the membership survey, the interviews, or by providing resources. So I hand over now to Cary, our CEO, who will present the preliminary results of the research that was done with the membership survey. Over to you, Cary.
Thank you very much, Anil. And if I could also offer my welcome to all of those who are participating today. There's some people there I've known for many years. So congratulations for all the work that you're doing around the world at the moment. And thank you for giving us your precious time to join us today. It's a lovely photo of the jet there in Geneva. I do hope everyone's coming to the World Cancer Congress and can see it. We may even have it coloured orange for the World Cancer Congress if we're lucky. Anyway, let's move on to the next slide and I'll give you a brief overview of the results from the membership survey. So the membership survey, if we go on to the next slide, please, is done every 2 years and every 4 years as with the strategy review as mentioned by Anil D'Cruz. So we always use a third party to do the membership survey and to analyze it and present back the results. And of course, to allow us to compare every other year to the previous years. Then we ask the same questions in the survey, although we may ask slightly different questions depending on the nature of the world that we find ourselves in. So we did include obviously questions about the impacts of COVID and the pandemic on members of UICC. Now, with over 20% of the membership responding to the survey, we've got a pretty good coverage of all our types of members and the geographies in which they work. And we also got a pretty good regional breakdown as well, and represents our membership that we see on a day-to-day basis from our 1,200 members in 173 countries. I'd like to thank Damvad Analytics for pulling all of this data together. And I really say thank you to all of you who actually took time to complete the survey, and also for those of you who participated in any face-to-face discussions. So as you can see, we had a good breakdown from the regions in our survey, and as you see on the left-hand side, that breakdown ranging from 7% in the Eastern Mediterranean, 29% in Asia Pacific. And if you look on the right-hand side, you'll see in the pie graph that that's a breakdown of where our members are around the world. Next slide, please. So these are the headlines, and there's more details behind this. But you'll see that we still are getting extremely high scores, and there has been some progress since the last time we met. Now, given the context of the pandemic, and we haven't met face-to-face at a Congress because we had to cancel the Oman Congress, we had to run the summit virtually, we've not had any regional meetings. These results are really very, very good, and we're very happy that the membership have given us such high scores. So 96% of respondents say that their relationship interacting with UICC is good or very good, and that's up from 86% in 2019. 92% of respondents will recommend UICC member to another organization, which is slightly down, but roughly the same as 2019. And 85% of organizations are very satisfied or satisfied with their membership, and a total of 51% are very satisfied, and that's up from 8% in 2019. So overall, the satisfaction rates with UICC as a membership organization have increased, and we're very proud to say that despite the challenges of the pandemic and all of us working remotely and off screens and Zoom and Teams, we've stayed together as a community, and I think we've responded to the challenges that we've all faced as a team, and not just Geneva with membership, but as the membership with membership. So my congratulations to everyone for keeping the great community of UICC together during these difficult times. Next slide, please. We asked a couple of questions which I think are quite important. How often do you contact UICC? And this can be personal, telephone call, email, online, social media. You can see that 92% respondents are pretty much in contact with UICC, ranging from daily, where we have a significant number of our members who are in daily contact with UICC, as well as those who are in monthly, around 30%, and a couple of times a year. But very few actually are in contact with UICC, which is good news, because the strength of our community is the ability to work together and to have a cohesive advocacy position, to help each other on World Cancer Day, to make sure that those who are struggling can reach out to us and benefit from the knowledge and experience of others around the community. So it's great to see that level of interaction that we have around the community. And how well do we keep you informed about the activities that we're doing? As you can see, very low numbers of poor results there, and overwhelmingly 62% saying that we do really keep you advised of what we're doing and how you can become involved. And I'm particularly pleased on this because we've had to change our operating model in the last 2 years to deliver the majority of our services online and virtually. And I can see that despite the fact that we're all a little tired of Zoom and Teams, nonetheless, by using those media, we've gone out to the members and we've been able to ensure that they understand what we're doing and why we're doing it. So that's great. And of course, it works the other way as well, because we're learning about what our members are doing and what their priorities are and how we can help them. Next slide, please. In terms of the areas where the membership see great value in the UICC's activities, and this is quite a busy slide, but the team have pulled out 3 areas where it's clear that there are some activities that we undertake which are very well respected, appreciated, and used by the membership. The first one is the invitations to the World Cancer Leaders Summit, which was virtual in Boston last year, but next year will be in Los Angeles, in Long Beach. World Cancer Day campaign, which has been running for 1 year under the new theme of Close the Care Gap, and we'll have 2 years to go. And we're really pleased with the uptake of that and how people embraced it country to country to get their key messages across. And the third area is virtual dialogues, like this one, where we're able to reach out to the communities. To be honest, we were not able to reach out to when we had the old face-to-face model, which seems so many years ago now. But you can see overwhelmingly there's some positive things in there, but those 3 stand out as the most relevant activities, which are really appreciated by the membership. Next slide, please. And in terms of how the COVID pandemic has impacted our community, well, there's a long tail of challenges and problems caused by COVID, not least for patients around the world who probably were not screened at an appropriate time or have somehow had delays in their treatment. But in terms of the the UIC membership organizations, we've seen some real challenges with regard to income, raising money during that period, particularly with a lack of runs and walks and cycle rides, etc. So not able to collect the funds that they've had before. And as a result of that, you've seen a reduction in organizational activities as well, because obviously things can't be funded. But I do hope that for all of you dialing in from around the world, that you are experiencing a change in the way in which the pandemic is affecting the communities that you live in, and that we are hopefully past the worst of that. And certainly it does feel like that when you're in Switzerland. But I think we're quite a unique country when it comes to the way in which it's been dealing with COVID. So what kind of support can we provide you in the wake of the pandemic? Access to funding opportunities, clearly from the challenges that our membership have had in securing the funds to do the work they do, but also to give them information, make sure the right resources are available, connectivity, making sure that relevant stakeholders are connected to others, and also provide training and support. So these are areas which are already in the heart of our operating model and will continue to be in the next few years as we all want to move out of the pandemic and not get back to usual, but actually do better than we were doing before the pandemic took place. Next slide, please. So now I'm going to move on to the strategy review, which has been conducted over the last few months, with the board having a workshop to review the information collected by DAMVAD, which wasn't just from the questionnaires that went out to our members and partners, but also from the interviews they conducted with global health leaders, leaders in the cancer community, and others. So I'm now going to present you with some of the results that came out of that. So you'll be pleased to know that DAMVAD Analytics have done a terrific job, and we've been really pleased with the work that they've done. They conducted themselves really professionally, turned around information very quickly, and assimilated the key points, which allowed the board of the organization to meet in May and have a thorough discussion about the key conclusions from the interviews and also the membership survey. So there was a number of challenges, mega trends, if you like, which were presented for the board to consider in the context of that 10 to 15-year horizon. And that was supplemented by desk research conducted by the UIC team, but also by interviews with the board members and past board members as well, those of you who've represented the members of UIC in past years. And through that, we've identified some mega trends which we believe will affect the way in which we can address cancer control globally over the next 15 years. So if we could go on to the next slide, what I would do is very quickly run through the headlines that they uncovered and allowed the board to discuss which of these mega trends we felt were the ones that were potentially most impactful on the way in which we want to achieve our purpose statement as an organization. So the first one is that patient engagement will continue to grow. Knowledge of patients, because of the advent of the information on internet, patient support groups being active in sharing information, connecting, and patients connecting with patients around the world. Second one, survivorship brings new perspectives as more and more people survive cancer. What does that mean in terms of how we deal with survivorship in the future, how we look after those who've had cancer and maybe have some lingering physical or mental problems due to their cancer treatment and care that they've had, and how, as we progressively save more lives, we deal with an increasing number of survivors around the world. Third trend is about population aging, and that we know that the aging population continues, and there's a growth in population as well. And we know that cancer is more prevalent in older adults. So with an aging population, what challenges that throw up for health systems and the way in which we deal with elder patients and the carers, etc. And what is the balance between them being in a hospital and being at home or being in care? Fourth one is the growing need for education and training, more awareness about cancer prevention in the wider population, what the risk factors are as we discover more about those risk factors. Now, we know a lot about tobacco control, but we don't know a lot about e-cigarettes at the moment. So what is it that we need in terms of education and training of the public and the education and training of professionals? There's a dire need for more healthcare workers in the future. And is it likely that we're going to close that gap over the next 15 years or so? Next slide, please. Data and innovation will change cancer control. So the way in which we use AI, machine learning will improve potentially the quality of care, the survival rates for treatment, for example. And how can we use data to actually make sure that we can reach out to the right populations when it comes to population health processes and procedures in order to reduce the disparities that we see. So how much data can we get hold of, and how can it help us improve the way that we do cancer control, whether that be through a registry, through a hospital, or through the information that we can hold on a particular individual. Lifestyle and environmental risk factors, climate change and urbanization. This was actually two different megatrends brought together, but you can see that this is about the big factors, how we live our life on this planet and how it will affect our opportunities to avoid or our potential to have cancer in the future. And as we have more and more urbanization, with potentially, I think 60% of the world's population living in cities by 2050, how will that affect the way that we are able to manage the risk factors for cancer, do screening, and then also treat those who are in the cities? Or more importantly, how do we reach out to the urban environments? Private and philanthropic giving is increasing. So what is the potential there as more and more individuals and the multi-billionaires of the world create foundations to support key initiatives around the world in health, rather like Gates and Bloomberg have done in the past, but also as corporate companies become more aware of the need for them to invest appropriately in the communities they live in and the people that they employ from, and now what impact will that have on health around the world and also in local communities and countries where those corporates actually operate. Next slide, please. Post-COVID, what will happen to the world? Will there be further pandemics? What's the financial shock that we will face, the economic consequence of that? And have we seen the opportunity to bring health to the top of government agendas around the world, because they recognize that investing in a health system allows you to be more resilient to future pandemic shocks, and through that actually can provide better health services and systems to deal with the NCDs and cancer specifically. Will there be instability due to political unrest or other crises? You know, where as we see at the moment, there are a number of challenges around the world with instability, political unrest, national unrest, the rise of certain political parties, which are more about working within a country rather than embracing a global approach to life. How will that affect the way in which we operate in cancer control around the world? Healthcare silos receive more attention, so maybe we will see that it will be more difficult to focus on cancer alone, that we have to integrate our thinking across universal health coverage and NCDs. And as the pandemic actually emphasized that a proper health system covers all of the issues which a community faces on the health perspective, and the current approach on silos probably be waning over time. And finally, the last one is about the growing demand for equal access to care and more awareness of equity in cancer control. I think, you know, certainly through UICC and the work we're doing on the World Cancer Day, we realize that we really do have to address the big issues in inequity, you know, where we are able to treat the same cancers, where one survival rate in one part of the world is, say, 20% over 5 years, whilst in another part of the world is 80%. But also there are inequities which exist within countries, between urban and rural, or even between different groups of people. So will this become a bigger issue for the world to address inequities, not just inequity in wealth, but inequity in health? Next slide, please. So these are the areas that were identified by DAMVAD and were presented to the board for discussion at their workshop a few weeks ago. And at this point, I would like to hand over to Maria Barbara, because Maria Barbara is going to use the infamous menti.com in order to see what your views are on those particular long-term megatrends and which ones you think are the ones that are going to affect your organization. So MBL, Maria Barbara, I'll pass back to you. And then if you could bring up the screen with the list of 11 again, then that'll help people decide which ones they want to go for. Okay.
Yeah, thank you, Cary. So as Cary mentioned, so now it's the time for you to have a say on the challenges and trends that the data gathering phase identified, and we would love to hear from you what trends and challenges will be affecting your organization. So the code is there. Yeah, the code is there, and that's the question. So you join Menti, and then you'll have all the trends, and then you could choose from them. Conscious that there are 11 of them, so I'll be quiet and let you read.
Perhaps I could just jump back in, Maria Barbara, to say that for those of you who are panicking, there's no right answer. Okay.
Yeah,
there's no prize. Okay. It's really from your perspective, given your organization, the country in which you operate and what you do, what are the top trends which you think will have a massive impact on cancer control in your country? So
we could start seeing the results coming in. So we're still getting answers. Ooh, it's changing.
So most curious about the two zeros.
Ulrika, hello, how are you?
Hello, I'm good, thank you. I'm getting,
there you are.
1 0 now. Oh, no, 0.
Ulrika, can I say, you cannot bias the voting by asking people to vote for the North, okay?
I didn't vote for them myself, so.
Anil, are you still there? It's interesting what's coming through.
It's really interesting.
Yes, Cary, I am there and following it nice and closely.
I think we're
nearly there, are we?
We're nearly there, I think.
Okay. Can we have them back again?
We have them back, please. Yeah. Just 1 second.
Okay, so I'm going to facilitate discussion now.
Yeah.
So let me start off. I mean, we've got a couple of board members there. So Ulrika and Anil. Any other board members online, Maria Barbara? I can't see.
Christiana's there.
Christiana, okay. So I mean, feel free to
contribute. Also there. Yeah.
So if I look at that, data and innovation will change cancer control. So 18% voting for that one. Did anyone vote for that and tell us why they think that's going to change cancer control in the next 15 years? I mean, I have my views, but it'd be interesting to hear anyone else who's got a view on that.
Access to information is
Hi, Mary.
Access to information is a great equalizer.
There you go. Mary, I don't know if everyone knows you're the past president of UICC, so welcome. And always a campaigner on the use of data and innovation, so yes. What about in your world then, in radiotherapy, Mary? What's going to happen in radiotherapy in the next 15 years?
Hopefully, the deficiency in access will be corrected to some extent, but it will take longer to have uniform access. But I think innovation, I'm very pleased with the results of this poll, because innovation and information and data and ability to have learning health systems, I think, is the key to progress.
Okay, excellent. Anyone else who has voted for data innovation? Want to add anything from that? Come on, I know there's some people out there who aren't shy, so I don't want to pick on anyone. Who else is there?
Hi, Cary. This is Myra here.
Hey, Myra. People don't know, Myra Khalifa used to be on the board of UICC for many years. Hi, Myra. How's Brazil? How are you doing?
Hello, Maurice from Brazil. I believe that regarding technology, the pathology, especially the telemedicine, will help very much with the teledigital exams. This is a big challenge for low and middle income countries to have diagnosis, the immunohistochemistry, and I am sure that this new technology will improve very much the access for the treatment, the early diagnosis and adequate treatment.
Now, Mauricio, I think we agree with you on that. Myra, are you still there, Myra?
Yes, I am.
Okay, go ahead, Myra.
I'm hoping very much to see new things coming. I think if we're still keep doing it in the same way, we're not going to move. So the innovation coming together with technology, I think using more the phones, navigating patients. I think we need to know where the patients are. And we lost them during COVID, and they're still out there. So I think for organizations like ours that are very large throughout Brazil, this would be a very, very good help.
Excellent. Thank you very much. Anyone else with views? We've got on 12%. I can't read it because my eyesight is going given my age. I'm sure someone does. What is the brown one there? Is that growing demand for equal access to care and more awareness for equity in cancer control? So that's come out loud and clear.
Cary, sorry
12%.
to interrupt. We have some hands up.
Okay.
I'll call on Blami Dao.
Okay, thank you, Maria. I am Blami Dao
Please go ahead.
From Jibago, based in Ouagadougou in Burkina Faso. I have voted for data innovation. I think quality data is the only way to show that we are making progress. Regarding innovation, mobile technology will help low and middle income countries to take to scale cancer prevention program. Over to you, Maria.
Thank you, Blami. And I've got Dr. Hadi, I can see you now.
Yep.
Hi, Cary. How are you? How's everyone?
Good to see you. Yeah, good to see you.
Thank you so much. I want to thank you for I was just finishing a strategic review for the charitable and humanitarian sector in Qatar. And before that, the Ministry of Public Health, those 2 months, it's all working on strategy for QCS, for the National Cancer Program, for the charitable and humanitarian sector. So it's a very interesting time. Regarding why did I think the data innovation is actually not only is going to affect the way that QCS or any organization work, is actually even will affect how UICC will work. Because one of the biggest investment that UICC could generate is having data and innovation in the way that they are working. And that you guys already started by, I mean, the silver lining of the pandemic, UICC is now booming with opportunity and data and innovation networking. So building on this and connecting the resources and the abilities and the need of improvement of each organization with the other in an innovative way, in a way that each organization know what each other have or need improvement. I think that would definitely affect UICC way of work.
Thank you very much for that, Dr. Hadi. And Gamal Amira? Gamal, can you, I can't hear you. You need to put your camera on.
You hear now? You hear me now?
Yeah, I can hear you now, yeah.
Thank you for the invitation, and I enjoyed every talk. I think we have a problem in developing countries is the prices of the medication, especially the new drugs, targeted therapy and such advanced therapies which are very expensive, far beyond the budget in the developing countries. I think there should be cooperation with the global companies to give prices less and less to, like Egypt, when we worked with the companies for virus C drugs and we get a very good price. So I think we should try to communicate and talk with the companies to give a chance for developing countries.
Thank you, Gamal. That's a point well made. Are there any other hands at all, Maria? I can't see any other hands. Is that...
No, I don't see any other hands, but just for information, we have put the top 3 priorities that have been identified on the chat. So you could see them on the chat also.
And what we will also do is we'll make available the DAMVAD results, which is more detailed than that, and we'll make them available to all UIC members. So Dr. Hadi, you can have all of that and you can use that in your own thinking if that helps you on the mega trends. Okay, so we'll make sure that everyone has that because it affects us all. It doesn't affect just UIC, it affects us all. Okay, shall we move on to the next section, if that's okay, MBL? We have the next slide.
Yeah.
So what happened with the strategic review with the board is that once we had discussed those mega trends and identified the ones that we felt were maybe the ones that we needed to keep in mind as we start thinking about the longer term operation of UICC and the cancer community more generally. Damvad also came up with some areas of maybe we should focus on. And so this next section is about the areas where the Damvad said, look, these are the things that maybe UIC should be pushing globally. So we should be arguing for better healthcare infrastructures. We should be arguing for more education, training, raising awareness. We should be making sure that cancer control is on the political agenda, both at national, global, and regional level. We should encourage all partners to collect and share data and best practice, okay? We should invest in technologies to improve and data for improved health. There should be, I think I saw Brenda made a point about we should focus more on prevention and early detection, using the new technologies to detect cancers earlier. We should focus on supporting cancer survivors, ensure that they have a quality life post their treatment and survival. We should support the global cancer community so that it works collectively, more collectively, using Zoom, using the technologies available now, because we moved away from just face-to-face to being more interactive as a community so we can share great practice quickly. UIC should try to stay relevant as a global organization. And I read that as being to make sure that we're not seen as just a cancer organization, but we're an organization that wants to be involved in the sustainable development goal discussions. We want to be involved in universal health coverage discussions, climate change discussions. We want to make sure that as an organization, we're seen as a value add to all of those discussions so we're not forgotten. Exploring new funding opportunities as they emerge in the future. And we should develop stronger and more diversified collaboration strategies, building on the work that we've done before, for example, creating new organizations so we can work in more partnership. And of course, the last one is to make sure that we showcase UICC's work, a tendency for UICC to be a bit humble and probably not talk about the great work that when I say UICC, I mean the community, not UICC Geneva, I mean UICC, the membership of UICC, to make sure we share all the great things that have been done by you and your organizations around the world. So it inspires and also helps others to think about how they can address the challenges that they're facing in their country. So we're going to do the same thing again. So Maria Barbara is going to facilitate another mentee. These are 12 areas where we can have focus in the future, some of which you probably recognize that we're doing pretty much now. But it was important for the board of the UICC to reflect on where our priority investment should be in the coming 10 years or so. So I'll hand back to you to MBL and maybe you could run that for us, yeah?
Yep, thank you, Cary. As Cary mentioned, so what we'll do another mentee, and you could identify the top areas that UICC should prioritize in. So we're gonna run it. Yeah, there it is. So we'll wait a little longer for this one because I think you could read the different options. And then I also take the opportunity to emphasize that these results that we're presenting are preliminary, and that's why we're holding this virtual dialogue to hear from you. And these would also be added to the data gathering.
Mara's asked for the query code. It's on the top of the screen, isn't it? 4804 1036.
Yeah, it's on the top. Yeah.
Okay.
Yeah, and Alessandra just put it on the chat.
All right, so the results are coming through. And just to emphasize, these results will go into the thinking as we write up the strategy for the board to sign off. And I think Maria Barbara will say later, we actually will present that new strategy at the General Assembly later in the year. Well, there's some interesting trends coming through straight away. So more focus on prevention and early detection. So I know I had the privilege of doing a podcast interview with Mary Gospodarovich yesterday. Thank you very much, Mary, for your time. But we did talk about down the staging, how we can get the world's cancer patients to present at stage 1, 2 instead of stage 3, 4. And what a massive impact that would have on cancer survival rates around the world. So more focus on prevention and early detection. So anyone who voted for prevention and early detection, anyone want to make any comments on that? Anyone got a hand up? They can make a comment on that. Hi, Mary. Back to Mary again. Hi, Mary.
Hi, so I wanted to comment not about prevention, but about the survey. You know, you put so many possibilities that the vote is a little bit split. And I actually think that UICC should work more upstream. You know, there's a danger of sort of creating false dichotomies, prevention versus treatment, you know, technology versus supportive care, and so on. Cancers are very complex diseases and they need all those interventions. Everything is needed. But what I think we need to do is change the mindset from that the cancer is complex, it is expensive, it is difficult, to sort of raising expectations that cancer can be prevented, can be cured, can be treated, and that investment in cancer is good for the economy. So I think the UICC is uniquely positioned to take a very high road and really keep the attention on cancer at the WHO, at the UN, and at other global institutions, because with climate change and conflict and economy and pandemics, there will be diluted attention on NCDs and cancer. The other more urgent events can overshadow and sort of you know, put some barriers to continued investment, continued progress in cancer. So I think that one thing UICC is well positioned to do is to keep that attention.
Yeah, Mary, I think you're absolutely right. And, you know, we certainly don't want to create any false dichotomies, but, you know, we do have cancer control in their name, and it involves prevention, detection, treatment and care. Ramsey, my dear friend, how are you? Your turn to speak, sir.
Thank you so much. I'm doing well. Thank you so much. And thanks to UICC for all this, you know, enviable engagement. I absolutely agree with Mary. But I just wanted to say that I was really, you know, my votes really would tilted, my top focus would really tilt towards getting cancer control and access, on the core to political agenda. The reason is, living and coming from low and middle income countries, this is really a major challenge, especially for Africa, you know, where we have massive, fantastic cancer control plans, well budgeted, well developed, but getting money to be put in for this cancer control plan becomes a very challenging, you know. So I really think UICC, you know, would really play a very enviable role going forward now. We have seen some progress. I remember, I think last year or so, the UICC heralded a sort of a connection between getting the Commonwealth secretaries to lead an elimination of cervical cancer, sort of intervention. And right now, we're beginning to see progress in that regard. So this is so important so that we can take issues around cancer to the head of government, to the top policymakers, because we can't even make progress in prevention and survivorship if there are no investments, you know, into cancer control. Thank you very much.
Okay, great. Thank you very much, Ramsey. And George, over to you.
Hello, good evening to everybody. I am George Kapetanakis. I'm from Greece, Hellenic Cancer Federation. And I want to make a comment. I see that more focus on prevention and early detection is number one. But I think we also have to take under consideration that in the previous section, lifestyle and environmental risk factors were lower than when I have, I believe that must be. So it's true that, and I also believe that prevention and detection are out of question, and we must have as a focus area. Also, cancer survivorship and quality of life. But I think that there is a connection with the previous section and the lifestyle and environmental risk factor, climate, etc., all the others. So I just wanted to make this comment, small comment, to get close one and the other. That's it.
Thank you very much, George. Benda, I can see your hands up. Benda, are you there? Benda, well, you're on mute at the moment, so we can't hear you. Okay, well, I see that Mandy Pratt-Chapman has added a whole load of comments. So we'll capture all the comments that are on the chat. Mandy, I can't believe we can't hear you talk, but there you go. And Bender's the same, not able to unmute. So I don't know what bug we've got in the system there. It's rather random. So thankfully, you can hear.
Oh, no, I can talk. I'm walking, so I thought it would be distracting. I was just saying that I think that if we do look upstream, that we can also think of, those ideas around climate change and pandemics also not being necessarily opposed to cancer control, but opportunities to lead collaboration for public health infrastructure, clinical infrastructure, doing things more efficiently and smartly, collaborating and sharing data so that we're not working. I mean, in my view, what we do isn't going to matter if we don't have a planet, and it's not going to matter if everyone keeps shooting each other. So like, how do we lead that conversation? How do we lead a conversation around collaborating across public and clinical infrastructure so that we can all votes are raised?
Good points, Mandy. Mandy, we're going to see you at the World Cancer Congress in October. Are you coming over?
I am. I will see you there.
How exciting. Haven't seen you for years. We could see you again. Cool. Okay. I think we've got enough. Is there any other comments from anyone else on that? I mean, as I say, this is going into the mix for all the thinking we're having. So we really appreciate the comments that you've made. And I can see that some people endorsed Mary's comments about avoiding those false dichotomies, etc., etc. Can I just open it up to any of the current board members? Christina, I don't know if you're there. Christina, do you want to say anything at all? Or Erika, are you there?
Yeah, I'm here, Cary.
Hi.
Thanks for all your input. It's been so interesting listening to the discussions. And I think we're having the same challenge that we had when we discussed the strategy and the focus areas on the board, because there are so many areas we really want to deep dive into, and we know that we can't do that. And we're actually having a discussion about what's really the role of the UICC and what kind of support do we give to our members. But I think we can probably try to sort of put more of these different focus areas or trends together and to condense them, combine them even better in the strategy that we're working on. So, and of course, I see some of my favorite subjects that are high ranked. So, for example, more focus on prevention and early detection, technologies, data, getting cancer control and access to care on the political agenda, and also some of the discussions we had on the previous slide. But it will be a challenge for us as a board making it one strategy, because there are all these focus areas, they are connected, and I think we all support what Mary said earlier.
Yeah, I think Mary made a good point there. Zainab, hello, how are you doing?
Hi, Cary, how are you?
Good to see you.
Yeah, good to see everyone. Very important meeting, and one that we spoke extensively on at the board level. I'm glad to see that the members, what they feel from the polling, from the votes that have been shared, it aligns basically with what we're saying. And again, to reiterate what we've said, what Mary said about avoiding the dichotomy, it's very important that we focus on things that are going to bring better outcomes. Survivorship for us in Africa is one that has been, should I say, overlooked quite a bit. So it's not one solution fits all, but at the end of the day, the UICC is there to cater for everyone's needs, and this strategy will take that into account. And then with the goals and everything that we're working on, we'll see the outcomes better. And to lend my voice again to what Rancy said about the need for supporting members to source for funding and to teach them how to source for funding. Sometimes the funding exists even in country, but a lot of people do not know how to strategize, how to meet the budget needs, how to really advocate for those fundings to come to the needs that they have as a cancer control organization. So very important meeting, and I hope that we'll be able to see the outcomes from this soon as an organization.
Super. Thank you very much, Zainab. Okay, well, I think I can't see any other hands, so I think we'll end there. And as I say, we are collecting all the comments that are coming through. So perhaps if I hand back to Maria Barbara, I hand back to you, Maria Barbara, now, and you talk about the strategy review timeline. Is that right?
Yep, that's correct, Cary. Thank you so much. We thought it would be important also for you to know that what's left on the timeline and what we've done. So from March to May, we did the data collection, as mentioned, and these are the preliminary results of that phase. We also held, the board of directors also held a strategy review workshop in May, like a month ago. And what it's next is to continue working on this. We, as we have mentioned many times already, we will add these discussions and your views into the process, and then we'll conduct further research, and the board of directors will approve the strategy that will be written down and will be presented at the General Assembly. And I'll take advantage of the floor to announce the General Assembly will be taking place on the 11th of October, and it will be a virtual event. So all of us will be able to join on the 11th of October. So that's what's next. And we would hope that you will continue supporting throughout the process. And thank you again for being part of it, because as a membership organization for UICC is highly important, and because we exist because of you, because of the members. So is this process, it ensures that we get your views and that we continue being relevant for you and continue to be the organization that you want us to be. So I think now I'll pass it through Anil. So you'll do some closing remarks before the end of the dialogue. Go ahead, Anil. The floor is yours.
Thanks, Maria. I think we've had some great discussion, interesting perspectives presented. Thank you, Cary, for presenting the data of the membership survey and steering us through a very, very interesting discussion. Maria, for anchoring us through this entire 1 hour, making it very, very interesting. And I was just watching the number of participants that we had, and it must have been riveting, because normally at these kind of meetings, you see slowly, you start with a high number and then you have people fall off the meeting. It's lovely to see that the numbers stayed pretty steady right through the entire discussions. There were many options given, and I do agree with Mary's comments that cancer is complex, but when you give too many options, you kind of split the vote. But when I looked and counted the options that were given on what UICC's focus should be, there were 13 options, and the vote ranged between 3 and 14%, just highlighting that everything that we do is important. There's small bits that we need to put together to fit that jigsaw and probably impact on cancer control, data, innovation, prevention, early detection coming up. But to me, the one thing that really stands out, both at the board discussions, our strategy reviews task force, and again, here it came up in bits and pieces, is equity. You need to have that accessibility in everything we do, whether it's prevention, whether it is data, whether there's innovation. Someone said about medicine access and that equity, we can close that gap. I'm sure we'll be able to have cases present early and probably have success in treatment. So there's a lot of work for us to do at UICC. We count on all of your members chipping in, keeping us on our toes, and taking us through this next strategy review, which we'll present to you at the General Assembly on October 11th. And that's when I look forward to meeting all of you all again. For the next steps, you all will receive a summary email, including various upcoming opportunities. Please do not hesitate to get in touch with the membership team for any information that you need. The email will be put in the chat now. Look forward again to welcoming you all to the 2022 World Cancer Congress. The initial enthusiasm has been outstanding. We've had some great session proposals that have come in, abstracts are pouring in. As you can see on the slide, over 600 participants have already registered, and I'm sure we'll have a wonderful time together in Geneva. So thanks once again for your engagement. Look forward to meeting you all on the General Assembly October 11th, and then at the World Cancer Congress 18th to 20th of October. Thank you once again, and Maria, back to you to conclude.
Thank you so much, Anil. So in the immediate future, we have some virtual dialogues planned for you, and many of you are already registered. So on Thursday, we'll have the virtual dialogue for Africa. Next week, the virtual dialogue for Asia Pacific. And you could use that link below so to get more information. And please don't hesitate, as always, to reach out to our membership team that will be pleased to help and to respond to any of the queries. So I think we've closed a very successful meeting. As Anil said, it's nice to see that all the participants stay throughout the hour. So thank you so much, and we'll be in touch for the regional dialogues, but also for the General Assembly to present the strategy. So we're looking forward to keep working with you. And once again, thank you so much for joining us. Thank you.
Thanks, everybody. Bye-bye.
Bye-bye.
Bye-bye, everyone.
Bye.
Bye.
Thank you.